Imagine waking up one day and realizing that you're no longer able to see your loved ones clearly, not able to enjoy those innocent expressions on your grandchildren's faces. Yes, after 40s, there are many eye diseases which can develop silently in your eyes without your notice and one day suddenly lead to sudden blurring of vision. Unfortunately, most of the vision damaging disease of the eyes are painless without any symptoms like redness, irritation, pain. And that's the reason a regular eye checkup after 40, which will pick up such diseases, is extremely important. Hi, I'm Dr. Shrutika Kankriya, a retinologist and a cataract surgeon, and I have come across many patients who have lost their vision or permanently developed blurry vision just because their eye disease didn't get diagnosed in time and hence didn't get treated in time. So let's understand together how to preserve the clear vision till the end of your life. So the most common disease which can develop as you age is cataract, especially in diabetic patients, and otherwise also cataract is not a disease but just an aging condition. But sometimes patients ignore the checkup for cataract and allow the cataract to keep progressing until it becomes very hard, leathery and brown, which can also make the cataract surgery risky, which otherwise is a very simple 10-minute procedure. Well, cataract is still reversible. It is very much under our control to do the surgery and give back the clear vision to the patient. But other important diseases are, for example, diabetic retinopathy. Diabetic patients are still unaware of the fact that diabetes can lead to blindness, and that too suddenly. So every diabetic patient needs to get a retina checkup every year. So what exactly does diabetes do to your retina? Diabetes affects the back portion of the eye, which is retina, where it blocks or damages the small red vessels in the retina, which can lead to loss of blood supply to the retina, swelling in the retina, which can give the blurry vision. Many patients think this blurry vision could be because of cataract and they delay the consultation with doctor, but diabetic retinopathy might be developing in the retina. Now, why does this diabetic retinopathy gets missed? Diabetic retinopathy, when it develops in your retina, doesn't give you any pain, doesn't give you any irritation, doesn't give you any redness, but it starts progressing in the side portion of your retina and doesn't affect the central portion of the retina, which does 90% of your task. So the patient never realizes that the diabetic retinopathy is progressing in the eyes and feels all is okay with his retina. That's why even if the vision is normal, diabetic patients need to check their retina once in a year at least, and especially more important if the sugars are uncontrolled, they have a kidney disease due to diabetes, diabetic nephropathy or diabetic heart disease. Next important eye disease that we need to screen is glaucoma. Glaucoma is a leading cause of blindness in India, and I have seen many educated patients as well losing their vision or sight to glaucoma. Glaucoma is typically known as the silent thief of vision because again it's painless. What happens in glaucoma is the eye pressure increases and it affects the nerve of the eye. When the nerve is affected, there is no pain, but gradually your side vision is shrinking from the sides, from the top, from the bottom. Patients don't realize until and unless almost 70% of their side vision is lost that something is going wrong with their eyes. And the most important thing that we need to remember is the vision loss is irreversible in glaucoma. The lost side vision cannot be regained. That's why glaucoma is known to be the silent thief of vision. This glaucomatous damage of the optic nerve can only be picked up through a retinal examination and a meticulous examination of the optic nerve, which can only happen in a tertiary care eye center. Now, the next very important retinal disease is age-related macular degeneration. Age-related macular degeneration affects the center portion of the retina. The center portion of the retina develops complex, unwanted, fine blood vessels which leak and cause swelling in the retina. This disease can progress over a period of 15 days, 1 month, leading to blurry vision, distortion of vision, and seeing straight lines curved. I always say this age-related macular degeneration is like local cancer. If we don't kill this disease or this abnormal blood vessel complex in time and completely, it will keep damaging your vision gradually to the extent where you will not be able to recognize the faces of people and will not be able to do your routine reading and writing. And even in age-related macular degeneration, early diagnosis and treatment is of utmost importance, just like in cancer patients. Now, the next question in your mind is, so what do I do to preserve my sight? Very simple. Get a complete eye checkup done. What does complete eye checkup involve? Complete eye checkup involves eye pressure checkup, vision checkup, and most importantly, retina and nerve checkup. Now, people have a general notion that I will have to put dilatation drops, expand my pupil, and then get the retina checked. I will have to rest the entire day, and the feeling of the dilatation is very, very cumbersome. Yes, for complete eye checkup, dilatation is required because retina cannot be examined without dilatation when it has to be done manually or clinically. But now we have advanced technology like Optos Daytona technology, which can capture the details of retina through an undilated pupil as well. So no hassle of getting dilatation, but still getting your retina and optic nerve screen is possible just in few minutes with this new technology. And if you are someone who doesn't want to invest much time, can benefit from such technology as well. But that doesn't mean you miss a eye checkup or a complete eye checkup involving retinal examination. So next very relevant question is, how often do I get my eyes checked? If you are over 40 and don't have any systemic history, don't have any family history of glaucoma or retinal detachment or any other problem, then a complete eye checkup every 1 to 2 years is enough. But if you're someone who has diabetes or a history of glaucoma, history of other eye diseases in the family, then a checkup every 9 months will be a good idea. So book your eye checkup today. Don't wait for the symptoms to appear. Stitching time saves 9. If you have a problem, let's diagnose it in time and treat in time to safeguard your vision for life. If you found this video helpful, please share with your relatives. Please like it and subscribe to our channel. Thank you.